All right, as we wrap up our course and we think about all of the diseases or many different diseases that are caused by microorganisms, I want to draw a couple clear connections to topics we learned about earlier in the semester. And in this video, I wanted to draw a clear connection between the outcomes of many diseases that we see and inflammation. So I think there's a really simple connection where we can connect common signs of an infection or of a disease and inflammation. And the connection's really clear, so let's think of it over. So if we reflect back, we should remember that there are 5 major characteristics of inflammation. They're redness, pain, heat, loss of function, and the one I really want to focus on today, swelling. We know that inflamed tissue is swollen because the fluid in our bloodstream leaks out of the blood vessels into the tissue. So we've talked in the past about how inflammation always increases vascular permeability. That's so the white blood cells can get into the tissue and protect us. But unfortunately, when we let the white blood cells out of the bloodstream, a bunch of fluid leaks into the tissue with them. That increases the volume of the tissue, and we get swelling. So why do I care so much about swelling right now? Again, I think this can explain several signs of disease that we commonly observe for some different infectious microorganisms. So let's think about how this inflammation is connected to the runny nose. So here I've got a cutaway of an individual's nose. So we've got our nostrils, we enter the nasal chamber, and it's lined by these mucosa or mucosal membranes or epithelial tissue right inside the nose. So we're going to think about why we get a runny nose. Why, when we're sick, do we experience a runny nose? So we know this is associated with upper respiratory tract infections like the cold. One of the main signs of the cold is I've got to wipe my nose a lot. I've got to blow my nose from time to time. So again, why does the cold cause a runny nose? So we know that viruses are getting in here and infecting the tissues in our nose. That viral infection is causing tissue damage. Tissue damage always results in inflammation. Inflammation always includes fluid accumulation in the tissue, swelling, because the vessels are becoming more permeable. The problem is this tissue that is being damaged and is experiencing inflammation and the accumulation of fluids is right on the surface. It's an epithelial tissue right on the surface. So the problem is there's nowhere to trap that fluid. It's not like getting inflammation in a muscle where the fluid will be trapped in that muscle and we'll have a swollen muscle. Because we're getting inflammation in this surface tissue, this epithelial tissue, there's nowhere for the fluid to be trapped. So it leaks right out of the tissue onto the surface, and then it leaks out my nose. And we call that, in science, rhinorrhea, right? A runny nose, the sciencey name for that is rhinorrhea. And again, it's directly related to the fact that the pathogen is damaging the epithelial tissue in the nose, and then that results in inflammation. Inflammation results in fluid loss from the tissue. This tissue cannot trap the fluid, so it runs right out the nose. What about pneumonia? So we know pneumonia is associated with lower respiratory tract infections, and lots of different infections can result in pneumonia. All pneumonia tells us is that there's fluid in the lungs. Well, why is there fluid in the lungs? Just like with the runny nose, we've got this tissue. Here we're looking at an alveoli in the lungs, right? So it's a little chamber of gas that's surrounded by vascular tissue so that we can easily exchange gas between the two. If a pathogen gets into the alveoli and begins to damage this tissue, we get an inflammatory response. Remember, tissue damage always results in inflammation. Inflammation always includes increased vascular permeability leading to swelling. But again, this alveoli is an empty sac. The fluid is going to leak out of that vasculature into the alveoli, filling it with fluid, right? The lungs there's nowhere to trap the fluid in the tissue. Instead, that fluid accumulates in these air spaces. Our lungs fill with fluid, and that is by definition pneumonia. Let's think about one more quick example, inflammation and diarrhea. So diarrhea is associated with gastrointestinal infections. So we'll get a pathogen in here into the small or large intestines. The pathogens are growing in here, damaging the epithelial tissue that lines the intestine. Again, tissue damage is going to result in inflammation. Inflammation includes increased vascular permeability. That means that fluid is going to leak into this epithelial tissue. But again, there's sort of an empty space here, the lumen of the intestines, so there's no tissue to sort of soak the fluid up into like a sponge, but rather that fluid is going to leak directly into the intestinal lumen. So again, we leak fluid out of the vasculature into that epithelial tissue. That epithelial tissue, because it's on a surface, cannot trap the fluid. The intestines accumulate that fluid, and we water down our stool, leading to diarrhea. So I think those are three super simple connections between a basic process that we learned about in immunology, inflammation, and three really common signs of disease: a runny nose, pneumonia in the lungs, or diarrhea. All of them can be directly linked to and explained by the inflammatory process. And it's those kinds of connections that I really hope we can make after spending a whole semester learning about microbes and their characteristics and how our bodies react to them, and then learning about the specific diseases as we end this course. So I hope that helps put that in perspective for you. As always, please let me know if you have any questions, and I'll talk to you again real soon.